Hi, my name is Juan Cadile, CEO of Salve. At Salve, we believe technology can one day prevent people from dying from heart diseases. I'd like to conduct a quick experiment that doesn't involve any expensive medical tests. Let's assume the people who watch this video represent the US population. The people who watch this video on even numbers, so the second, the fourth, sixth, etc., are suffering from some form of heart disease. On the other hand, the people who watch this video on the odd numbers, so first, third, fifth, and so on, are not suffering from any form of heart disease. I know that's a strong statement, but that is what a 2019 research conducted by the American Heart Association shows about the US population. When I was 12 years old, I heard my mom crying out loud for the first time. She had been diagnosed with arrhythmia, the same condition my grandmother had. Anyways, I was just a kid and I didn't know what the condition meant, so I just cried along. 2 years ago, Manuel, one of my dad's employees and a dear friend of mine, passed away from his second heart attack. He had survived his first heart attack half a decade earlier. We were close. He used to teach me the programming fundamentals by using super simple analogies. But what I really learned from him was how appreciative of life he came to be, even though he was not living as a patient, with many distresses and angst. He is not alone. 1 in every 4 deaths in the United States are caused by heart disease. And globally, 18 million people die from heart disease each year. To further put this into perspective, by the end of this pitch, about 15 people will have died. That means about 1 death every 40 seconds. Salve is building an algorithm that monitors heart health, detects potential heart conditions, and predicts heart events by tracking patient vitals and habits, combined with medical diagnostics. Our platform is being designed to prevent cardiac-related deaths and promote a healthier lifestyle. Now we will be providing patients with a live monitoring system that lives on their wearable smart device and uses our machine learning algorithm to detect and categorize heart diseases and risks. We ultimately want our platform to be able to predict symptoms of sudden cardiac arrests. Those are the heart attacks that are silent and therefore nearly impossible to detect. To save people from dying from heart diseases and cardiac arrests, we need to turn cardiology into a proactive instead of a reactive science. And this technology allows us to do just that. Our biggest challenge is data, as data on heart health is very limited and healthcare data is regulated by HIPAA regulations. If you have access to this kind of data, please do reach out. To gather data, we're working on 2 campaigns, Your Parents' Heart and Risky Conditions, targeting our most specific user base, the elderly and those who suffer from other diseases that augment the risk of cardiac disease. This research will allow us to gather our initial data sets. Participants will be tested during a period of time in which we will collect all the necessary information. And in exchange, we will provide them and their parents with a free care plan. We're building our platform using Apple's health, care, and research kits, which allow us to easily gather information from people's phones and wearables. Nonetheless, this is not restrictive. Apple's research kit is open source and its data cross-compatible. That means we can start building on an already existing platform and then grow onto other platforms without complications. In the United States, 150 million people are estimated to have a heart disease. That is equivalent to almost 50% of its population. Now, there are around 69 million people with smart devices in the United States. And so we estimate that around 18.3 million Americans who have wearable devices have also a cardiovascular disease. As Salve needs a wearable smart device to work, so we will be targeting those 18.3 million Americans who have those wearables. Now, while there isn't enough concrete information about the previously mentioned statements, we calculated our averages based on results from the American Heart Association and the US Census. Now, everyone will be able to enter our Salve ecosystem through our free diagnosis. Users who are at risk or have a cardiovascular disease will be able to sign up for a life care service, which costs $200 a year. As we improve our platform and develop new products, we will introduce healthcare data backup, so patients always know their heart health history. We will also introduce a medic-facing platform to track their patients in real time. Ultimately, we want to offer a service and a platform for hospitals, researchers, and other kinds of institutions. Our go-to-market strategy starts with our previously mentioned campaigns and educational content targeted to inform our specific audience while also establishing a valuable brand. Our main competitors rely heavily on selling their proprietary hardware, while Salve focuses on our software platform and leverages existing technologies that are better designed and are already appealing to users that will help us find a greater market fit. Our focus is on the aggregation of data for further perfection of algorithm to achieve the best results without the need for extra apparatus. In addition, there is no market leader. We're very excited about the future and to fulfill our mission of helping humanity fight their number one cause of death. We will proceed to achieve funding to enable and accelerate the research process, develop a HIPAA-compliant data ingestion app. This will be the module for our research. We also need to launch our marketing campaigns to educate people and start the research. We need to establish medical research partnerships to engage in multidisciplinary discussions to understand even further our task at hand, and guide our data scientists in the data ingestion and analysis phase, which will be used to start training our algorithm up to an 80% accuracy rate. Once we reach that, we will be able to launch Salve. As previously stated, our principal need is data, for which we will conduct research. If you have access to health data, please do reach out. Regarding our financial needs, we are seeking to raise a $50,000 initial round to acquire the necessary hardware for development and testing, training of our machine learning neural network, and other expenses related to compliance, publishing, and marketing of our research campaigns. Now, it is extremely early to think about exit strategies. Nonetheless, we know that possible exits are selling to a pharmaceutical or an insurance company, selling to a hospital, selling to research institutions, or selling to a wearable device company. Lastly, I'd like to briefly go over the team. I'm Juan, the CEO of Salve. I'm a solopreneur. I have founded 2 successful companies in foreign markets related to digital media and content creation. I am a full-time student at Iona College, currently pursuing majors in computer science and philosophy, and a minor in entrepreneurship. Brian Uribe and Danny Pataki are my advisors. Brian Uribe is a marketing MBA, an international business management major with 7 years of sales experience. He's founded 4 companies, of which 3 are successful. Danny Pataki holds an International Affairs Master from Harvard University and a major in International Economics and Philosophy from Iona College. Currently, he's the CEO of Axel 7, an early-stage startup incubator and accelerator in the greater Hudson Valley region. We hope you join us moving sciences forward. Thank you very much, and I'm looking forward to answering all your questions next Friday.